A medical team on Wednesday shared their experience completing a COVID aid mission in Eswatini. At a press conference, they said the South African nation had been hit especially hard by the pandemic, like many other poorer parts of the world.
During a 2-month stay, the team shared medical expertise on COVID with local healthcare staff, teaching ways to lower transmission risk inside a hospital.
It's Taiwan's national flag next to Eswatini's. It's a photo of a medical team from Taipei Medical University Hospital. In May, the team went to Eswatini to combat the country's coronavirus outbreak.
第一次的话就是派一个私人飞机。 那同时呢，把我们台湾给他们的一些口罩。
The first time, it was a private flight. We took face masks, personal protective equipment, and 20 ventilators. That was the first batch of supplies that we brought along.
当我们收到讯息，大概是4月底的时候。
When we received the news, it was late April. By then, the epidemic was beginning to slow in Taiwan, so we were very happy to get this opportunity to help our allies.
The team was 2 doctors, a respiratory therapist, and an intensive care nurse. In May, with COVID abating, they headed to Africa, where the pandemic was at its worst.
Over there, nurses' duties are different. There is one nurse who gives out medicine, and that'll be all they do, give out medicine. Then there is another who is in charge of giving injections, and they'll be the one to give injections to everyone. During an epidemic, if one person comes into contact with a lot of people, the likelihood of cross-infection grows considerably. So we gave them some advice about that. Another thing is that they have a severe shortage of intensive care professionals.
Compared to Taiwan, Eswatini is poor in medical resources. There's also a lack of knowledge about COVID and related health guidelines. The Taiwanese medical team trained locals and shared their medical experience. After a 2-month stay, they returned to Taiwan on July 1st and entered a 14-day self-quarantine. Later on, a passenger on the return flight tested positive for COVID, so the team's home quarantine was upgraded to home isolation.
It was patient number 442. He kept coughing throughout the flight. He sounded as if he had a lot of phlegm. Of course, we wore gloves and washed our hands. We made sure to do all of that.
The 4 medical professionals have since cleared self-isolation. They held a press conference with Eswatini representatives on Wednesday to report on their aid mission.